Hi, my name's Dr. Ria Clarke and I'm an obstetrician and gynaecologist working within the NHS. The pronouns I use are she, her. A caesarean or a C-section is an operation where the baby's birthed via the abdomen rather than vaginally. This takes place in a hospital within an operating theatre and is done by obstetricians like me. I love doing caesareans. If that's a mode of birth that you've chosen or that you experience, you'll usually be in theatre for maybe up to 2 hours, but the operation itself takes 30 minutes to an hour. So most people having a C-section will be awake during the procedure and you'll receive a type of anaesthetic that is given through the back, similar to an epidural, and that's done by doctors who are specialists in pain and theatre management called anaesthetists. There are other methods of anaesthesia during a C-section. You may have heard of something called general anaesthetics, which is where people are put to sleep during the procedure and then woken up again. It's important to know the type of pain relief that you might get when you have a C-section, because there are implications in terms of what you'll remember and also who might be with you during the procedure. If you have a general anaesthetic, for example, many trusts don't allow the birth partner to be with you during the process. So it's something that you really want to make sure you understand. And if there's a choice, you want to make sure you have as much information as possible before you decide what's right for you. Caesarean section as a mode of delivery can be really polarising. You may have seen or heard lots of opinions about people having caesareans, and that can be really hard to hear. What's important is that you make the right choice for you and your family, that you do it from a place of information, and that that's based on fact. As long as you've made the right decision for you, you felt empowered to do so, and you feel positive about it, that's what you need to remember. Other people's opinions about your birth should not get any weight at all. They're just not important. Some people will choose to have a C-section even if they don't have a medical reason. That is still a legitimate choice and it should be supported. We know that the NICE guidelines say that people should be offered a choice section if they want one. There may be more processes that you need to go through if that's the right decision for you, but do remember that it's our job to hold your hand and support you through the process. A C-section is an operation and all operations have risks. The team looking after you will take you through the individual risks because some of the risks may be individual to you, but the most common risks with a C-section are bleeding and infection. That doesn't mean that you will have a bad time because you have a C-section, but it's also important to know what the risks are when you're making a decision about whether it's the right choice for you. And it's worth knowing them anyway, because we know that not everybody plans to have a C-section, but some people do end up having one. So factors like whether you've had any previous abdominal surgery, how big you'd like your family to be, and whether you have any pre-existing medical problems can all help advise about whether a C-section is the right choice for you and your family. There are some parts of having a C-section that people aren't necessarily made aware of in advance and something that you might not think about when having the operation. One of those things is that if you have a C-section, you'll be offered a catheter. Now, a catheter is a small tube, usually made of sterile rubber, that sits inside the bladder, and it helps to drain the bladder to keep it from inflating with urine during the procedure. That reduces the risk of injury to the bladder during the procedure, and that's important because bladder injuries are one of the more common complications. If you're having a catheter inserted, that can mean that people need to examine the vaginal and genital area in order to see where to insert it. Now, if you're having a C-section because you don't want people to examine you down there, it's really important to know that in advance. Another aspect is that at the end of a C-section, we clean out the vagina to make sure that there aren't any clots in the vagina. It's normal for blood to clot during the procedure, but we like to weigh it so we know what your total blood loss is. Again, if you're having a C-section because you'd rather people didn't examine your vagina, it's important to know that that's something we tend to do as standard, because that may guide how you make choices or what's communicated to us when we're doing the procedure. So let's talk about the different types of C-sections that people experience. The first type are known as planned or elective C-sections. These are C-sections where you're given a date and a time period in advance. It will either be the morning or the afternoon. And for these, you'll know what to expect. A team will take you through things beforehand. They'll show you a consent form and explain what should happen. The types of reasons that people will have a planned C-section are things like if you have a breech baby, which means their bottom is first, If you have pre-existing medical conditions, which mean a C-section is safest for you or your family. If you choose to have a C-section because that's the right choice for you and your family, then you'll also be offered an elective slot. The next type of C-sections are unplanned or emergency sections. Now, like it says on the tin, if you've had one of these or you're having one, you won't know necessarily in advance that that's going to happen. And how quickly these happen can depend on the reason that we're doing them. It might be that someone decides that it's best for baby to come out within the next day or within the next few hours, but it can be that that decision's made very, very quickly within minutes. And that can be a lot to take on psychologically. Not only have you found out that your baby needs to come out quickly, but you also are about to have a major operation that wasn't necessarily on your radar, and that can be really scary. If that's something you experience, then the team should debrief you afterwards if that's appropriate, and you may not feel ready for that. There are always debriefs that can happen at any point after the baby's born, even if it's been months or years. Something that we're seeing more is gentle or natural C-sections. Now, it's important to say that the actual operation is still the same. The aim is to safely deliver your baby or birth your baby through the abdomen. What's different about gentle C-sections is that you're more involved in the process. So with a gentle C-section, the actual operation is still the same, but it may be that you're more involved in the birthing process with the baby. In a C-section, that can mean that you're delivering baby yourself by guiding the baby up through the abdomen onto your chest, or that baby stays with you rather than being taken over to something called a resuscitaire, which is a special bed that midwives and neonatal teams examine babies on, or that, for example, the placenta and the cord remain attached rather than being clamped and cut. So whether a gentle C-section is an option for you will depend on the trust that you're booked at. It's worth discussing with the team early on, because it might be that they haven't done it very much before, but that doesn't mean that they wouldn't be open to it. It does take a bit more planning, but if it's something that's really important to you, have a look on some videos to see what's been done before and discuss it with your team. I've been involved with a few of them and they're lovely. So an important thing to remember if you are having a C-section is that it doesn't mean that things like hypnobirthing aren't important. In fact, hypnobirthing, being in touch with your body and your needs and being able to communicate that can be even more important in a situation where perhaps more people are involved in your birth than you anticipated, or because you wanted a C-section but still find the values of hypnobirthing really important. I find that people that use hypnobirthing get so much benefit from that, and that's even if you're in theatre having a C-section. Don't forget everything that hypnobirthing teaches you and empowers you to have, because it's still really important.